Good afternoon, welcome, and thanks for joining us today at Talking Point. Talking Point is a regular series of publicly available lectures that aim to inspire, inform, and challenge our notions of what we know about addiction and its impact on society. And I've no doubt that today's talk will do just that. I'm Victoria Manning. I'm the Head of Research and Workforce Development at Turning Point and an Associate Professor in Addictions at Monash University. I'll be chairing today's session. I'm very excited that today's speaker is Dr. Jason Jeong, and the topic is Beyond the Drinker, Alcohol's Hidden Cost in Australia. I'm sure many of you would have heard about this paper that's come out recently and seen some of the media coverage on this important and impressive body of work on the societal costs of alcohol when we look at harm beyond the person consuming alcohol and consider its impact on others like family, friends, colleagues, the broader society and health and welfare systems. Before I formally introduce Jason, I would like to acknowledge the traditional custodians of the various lands on which we meet today. I myself am on Wurundjeri land of the Kulin Nation and pay my respect to the elders past and present and emerging, and welcome any Aboriginal or Torres Strait Islander people joining us today. Sovereignty has never been ceded, it always was and always will be Aboriginal land. I'm sure you're all very used to the setup by now with webinars and things, but a quick bit of housekeeping. It is run as a webinar and we like to keep them as interactive as possible. So please feel free to put any questions you have for Jason via the Q&A function, and the chat function is disabled. I will filter those and hopefully he can address as many of those as possible at the end of his presentation. And one of the most common questions we get is, will the recording be up on the website? And the answer to that is yes. And the second most common question I think we often get is, will the PowerPoints be distributed via email? And the answer again is yes. So hopefully in about a month they should be available. So Dr. Jason Jeong is a health economist at the Centre for Alcohol Policy Research, also known as CAPER, the Department of Public Health and School of Psychology and Public Health at La Trobe University. He conducts quantitative and economic analyses in relation to the harmful use of alcohol, tobacco, and other drugs, with particular research interest on estimating its impacts on policy or program interventions on alcohol, tobacco, and drug use, and related social and health issues. I'm delighted to introduce you to Jason and hand over to you now, Jason.
Thank you, Vic. It's very pleasure to be here to share my research, our recent paper, which is Beyond the Drinker, Alcohol's Hidden Cost in Australia. So first, I'd like to begin by acknowledging the traditional custodian of the land on which we meet today and pay our respect to the elders past and present. I extend that respect to Aboriginal and Torres Strait Island peoples here today. I'd like to acknowledge our project team. These are our team members, Amory, Robin Room, Professor Chris Doran, Tanya Socrates, Sandra Cutchin, Robin Dwyer, Rebecca Jackinson, and Professor Diana Edgerton-Warburton. Our project funded by NHMIC project grants and recently as a linkage project. What we already know about alcohol and alcohol use, the WHO's report on global status of alcohol use report shows 3 million people die a year due to alcohol use. And for every 10 seconds, there's one people who die because of alcohol use. Alcohol is one of the most common preventable risk factors for non-communicable disease and injuries. And alcohol use also affects the achievement of more than half of the United Nations Sustainable Development Goals. There's the report from WHO shows for every dollar invested to reduce alcohol use, the return of investment is 9 times higher. Along with other risky behaviors like tobacco, smoking, unhealthy diet, physical inactivity, and alcohol use was found associated with various non-communicable diseases, such as cancer, liver diseases, heart diseases, and other chronic diseases. And also, the research evidence shows alcohol consumption was positively associated with intentional and unintentional injuries like suicide, assault, and accident, fall, or drowning. Alcohol consumption not only associated with non-communicable disease and injuries, but also associated with various social problems. Alcohol use was also resulting in harms beyond the drinker. A lot of studies, they focus on the alcohol, harmful use of alcohol, but focus on the drinker themselves, such as various chronic disease and intentional harms. But we've done our team have done this study since I think since 2000. We've done a lot of studies on alcohol's harm to others. So drinking alcohol not only harm to the drinker themselves, but also harm to the people around them, like the families and household living with the drinker. They might be harmed because the drinkers drinking. They have to do more home duties or looking after drinkers' children or dependents, or they have been have personal belongings or properties being damaged by the drinker. And as a friend of the harmful drinker, they sometimes need to looking after the drinking friends, or have to do something that take extra responsibility that they don't need to do for those harmful drinker. And the drinker drinking also can harm the co-workers. Because of drinking, they might forgot to do some work, or because of drinking, long-term heavy drinking, they got some diseases, they have to go to the hospital or treatments, and that reduce their work productivity significantly. And the co-workers have to take extra responsibility to do that. Also, the strangers drinking, I'm not sure how many of you have been experienced harms from strangers drinking, but I do. Sometimes I heard the people yelling in the middle of the night and wake me up because they just talking and throw the drinking bottles on the streets. And one of my very typical experience when I start my work at Turning Points, there's one night I woke a bit late and I walk out of the Turning Point building beside of the garden, and there's a drunk man just walk across me and try to punch me. I was really scared and I escaped and running away from that drunk person, and that how to say emphasize me or enhance my aims to develop more useful policy and program intervention to reduce alcohol's harm to others. Alcohol use has led to substantial economic cost to our society. It includes tangible cost and intangible cost. In the tangible cost, it has two divisions. One is direct cost, one indirect cost. The direct tangible costs include law enforcement, policing costs, healthcare, and social services related costs. Also, the direct costs include car, property, personal belonging damages. The indirect costs include work absenteeism, unemployment due to heavy drinking, decreased productivities, reducing learning potential. There's some opportunity cost because of drinking because of drinking alcohol. The intangible costs include such as pain, suffering, and lower quality of life for the drinker, but also for the people around the drinker. So there's a good question. Why we need to know economic cost of alcohol use? Here are four key reasons. First, understanding economic cost of alcohol-related harm is important because it can help the policymakers to make policy decisions. And the cost estimates provide useful information on the type and the magnitude of harm and the potential savings for strategies that prevent or reduce the incidence of alcohol-related harm. So without doing the cost estimate, we are not sure what type of harm and the magnitude of harm that are being caused by alcohol use. And cost estimates allow the weighing up of vastly different issues in the same framework. Like they can combine economic impact of death, loss of productivity, or lower quality of life, or spend the time on caring or looking after the drinker or drinker's dependents. And put all those different indicators in the same metrics, and we can compare. And also, we are able to compare the cost of alcohol use with other risk factors like tobacco consumption and like violence or other different risk behaviors. Moreover, deriving cost estimates also help to identify information gaps. Then we want to know which area in our surveillance system or reporting system we don't have this typical or important information. Then we can develop and put the research needs and practice to help to connect those useful information. And also the cost estimation study can increase public awareness of the economic burden of alcohol use in the society. Here are some literatures about existing cost studies on the alcohol use in the field. The societal cost of alcohol use is large, amounting to more than 1% of gross national products in many high and middle income countries. And that's by the Jürgen Rühm's paper, Lancet paper. And the cost of excessive alcohol consumption was estimated at $249 billion in the US in 2010. And the societal cost of alcohol use was about 16.6 billion Canada dollars in Canada in 2017. And in Australia, there are two very classical cost estimation on alcohol-related harms, which is predominantly driven by the work of Collins Lapsley from 1990s to 2008, which shows, their study shows the social cost of alcohol use in 2004 to 2005 was $15 billion. And then this figure was updated by others with using the same method using 2010 data, which is $14 billion in 2010. Their cost estimation was, to here is a bit far out of date, with some significant flaws in the method, because they exclude the cost of interpersonal harms due to others drinking, and on several key social harms like health-related quality of life loss due to alcohol use. And the last year, National Drug Research Institute has published an estimation on cost of alcohol use in Australia. And this is a very new study. They used the data from various sources in Australia in 2017 to 18, and they conclude that alcohol use in Australia amounting for $67 billion in Australia. And this study mainly focused on the cost of alcohol use to the drinker. It also covered a little bit of alcohol harm to others in the cost estimation, including crime estimation. It included both the cost of crime to the drinker and the victims, and also the traffic injuries involve both drink drivers and passengers and pedestrians, and also the cost of child protection and cost to the child abuse due to the alcohol use. And these part all belongs to the alcohol harm to others that we will cover later on in our study. And you might not have good idea how big is $76 billion worth. And this chart is the Australian government spending in 2019 to 2020 financial year. As we can see, the Australian government has spent $30 $36 billion in education and $32 billion in defense. If we sum up education and defense spending together, which is equal to the cost of alcohol use. So, well, that's such a big number. If we can reduce alcohol-related harm, or let's say reduce half of the alcohol-related harm, the cost of alcohol use might be reduced by $30 billion, which we can double our spending on education or defense. That significantly help the Australian society and economy. However, the existing cost study on the cost of alcohol use, what we can see is like iceberg here. We only see the ice is above the water, but ice under the water we're not sure, and we call this as a hidden cost of alcohol harms. I've created a figure here to showing the economic cost of alcohol use. The top part is the cost to drinker, and that's the most of the existing study have done. And our study, recently published, focused on the interpersonal cost due to others drinking. So we can see it also included direct cost, indirect cost, tangible cost, and various harms from others drinking. I'll talk them in the following slides. So in this study, our research aims is to quantify a variety of elements of economic cost due to others drinking in Australia, including quantify the tangible cost for healthcare and social services, time spent seeking health and social services, out-of-pocket expense, and loss of productivity, and also include another aim to quantify intangible cost, including the quality of life loss attributable to other people's alcohol consumption, and also the cost to the premature deaths that due to other people's alcohol consumption. And we have published our paper in the Journal of Studies on Alcohol and the Drugs. And you're welcome to read this paper. And if you have any questions, you can email me. We've connected various, a lot of data from different data custodians, and also we conducted alcohol harm total survey. How to say that, because we've done this, a new harm total survey in 2021, but we haven't analyzed data. But this study was started in 2018. So we used the alcohol harm total survey data. It's a pretty old one. From the alcohol harm total survey 2008. However, all our secondary data were from 2016 to 2017. It depends on the custodian. Like mortality data, we connect from ABS. Morbidity, which is hospitalization and emergency department data, we connected from AIHW. And their data was, reported in the financial year. So it's 2016 to 17. Crime rates, we connect from state police, Western Australian police, and police records in the New South Wales and the Victoria police data. Treatment and counseling data, we connected from published report in the government, and family and child protection cases, we connect also from the published report. In the alcohol harm total survey, in the 2008 version, we measured the property or personal belongings damages and whether or not the respondent has spent the time caring for others, like caring for the drinker, looking after the drinkers, children and their dependents, and whether or not they've been cleaning for the drinker and picking the drinker or drive them to somewhere. And also we measure the time spent for those participants who've been harmed by the drinking, for them to seek health and public services. And their out-of-pocket expense, such as if they go to the alcohol-dependent treatment services because they're not looking for the problem for themselves. They're looking for the problem for their families or people around them. They have to pay for it, which is not covered by the existing healthcare system. For the medical system, Medicare system. And we measure the health-related quality of life for those people who been harmed by the drinking and for those people didn't receive any harm from others drinking. And we compare the difference and calculate the people, calculate the loss of health-related quality of life for those people being harmed by others drinking. Then we connect cost information from various resources in the paper, published paper, government reports, and hospital cost review system. We then use the unit cost of different harms, then multiple with the instance and prevalence to work out the cost for productivity lost, cost for quality of life lost, cost for hospitalization, ED presentations, or due to others drinking, and those cost for different services. So the costing method in this paper, we adopted the cost of yearnings and societal costing method, which is two classical costing method being being in the field for over 20 years. There's a WHO's report on the cost method for the substance use and abuse. So that's the referencing book we use. We quantified the proportion of national cost for healthcare and social services, crime cost, cost of productivity loss, including mortality, morbidity, associated productivity or life loss, and time spent in seeking treatment and social services, and the cost of health-related quality of life loss and other expenses like out-of-pocket expenses and property damage that can be reasonably attributable to others' alcohol use. So for some of the costs, we only can get a reasonable proportion of those cases attributable to others' alcohol use. We can't get exactly figures. So some of course, have to calculate by the alcohol attributable fraction, but due to others drinking. This is the result of the first estimation, which is the cost of morbidity and mortality cost. We used data from custodian to calculate that we call it here PAAF is population alcohol attributable fraction. That means in these cases, for example, child assault and abuse, based on the data estimation, we found 27% cases of the child assault abuse were attributable to their parents or other people's alcohol consumption. Then we times with the deaths of the child assault abuse in the year of 2016. Then we find 6 deaths. Then we time with we calculate how many year of life lost. Then we time with the cost of year of life lost. We work out the total mortality cost for each of these 4 harm items. So as we can see here, adult assault, there are 41, nearly 42% of adult assault attributable to alcohol use, and that's due to others drinking. We get this figure from pulling the data from Victoria Police, Western Australian Police, and New South Wales Police data. We found 42% of victims report they've been harmed by the perpetrator who is under influence of alcohol. And we also found 14% of adult road crash, which are attributable to alcohol use. And then we use the same method for the hospitalizations, but also include the lost output cost. The total cost for the mortality that attributable to other people's drinking is $373 million in Australia in 2016, and the total morbidity cost attributable to others drinking in 2016 was $84 million. We estimated the alcohol-related interpersonal violence incidents in Australia, which is over 40,000 cases. And for non-domestic violence, we found, which is all from police data, is found from 154,000 cases in the 2016. And also there's alcohol-related sexual violence in Australia in 2016 is 46,700 in Australia. And this data were published in the ABS report on the recorded crime committed in 2016. The total estimated cost of violence attributable to others drinking in Australia was quite large, equals to $560 million in 2016, and non-domestic violence take a larger proportion of this violence that are attributable to others drinking. And this is very interesting part in our survey. We conduct a survey to measure the people's health-related quality of life using the EQ5D measure, which is Eurocode measure to compare the people who being harmed a little or a lot by others drinking. That's by the non-drinker, that's by the strangers drinking, and then compare with the people who did not affected by others drinking or do not have harmful drinking in their life, to see how their quality of life difference between those three groups, who being harmed a little, lot, or who not harmed. Then we calculated the quality of life. We call it quality of adjusted life year difference between three subgroups. For example, here we found in this study in the 2018 Australia, there are about 18% respondents reportedly being harmed a little by a non-harmful drink around them, and 8% respondents reportedly were harmed by a non-drink around them in the 2008. And the people who were harmed a lot reported significantly lower quality of life compared with the people do not harmed at all. And the changes in mean quality score in terms with cost per quality per person, then we calculate the cost of health-related quality of life loss. For the Australian, then we sum up with the people who were harmed by strangers. Together, we got the total cost were harmed by non-drinker and strangers for the lower quality of life in Australia is nearly $8 billion. Yeah. And in the survey, we also measured the time spent caring for the drinker and their dependents, and time spent working extra hours because of co-workers drinking. In this survey, we find nearly 30% respondents report they have spent some time looking after the harmful drinker and also their dependents, like children or older dependents. And only 2% of the respondents reported they're working extra hours because of co-workers drinking. And we use these figures proportion to time with population data, population in Australia, and we work out how many cases and how many hours being spent looking after the drinker, and also working extra hours for the co-workers drinking. The cost of productivity loss, we consider if the people who can spend these hours on working, then it will create low more productivity. So the loss of productivity due to spend time looking after the drinker and also taking extra work for co-workers were nearly $3 billion and $414 million annually in Australia. And this is another result. Is the damage to the property and the personal belongings and their out-of-pocket cost due to others drinking. We have split them by non-drinker and strangers. As we can see, the most of out-of-pocket cost attributable to the non-drinkers drinking, and the property damage and personal belongings are mainly attributable to strangers drinking. So same 28% respondent reported that they've been paid some out-of-pocket spend due to non-drinkers drinking. It's about 10% respondents report they have property damage attributable to strangers drinking, and 6% respondent report their personal belongings being damaged due to the strangers drinking. We calculate the average cost per of these incidents per year, and then time with the population cases here. We work out the total cost for out-of-pocket and damage to the property and personal belongings is $5 billion. And that's very interesting part is the cost of social services that participant has been used because of others drinking. The cost of time spent, we split this by two parts, which one is the cost of time spent by the people seeking services because of others drinking, and out-of-pocket expense by people using services because of others drinking. The time spent including calling police, hospital admissions, they wait for treatment or seeking other medical treatment or waiting for seeking counseling or professional advices. Then that's the prevalence of using services and the prevalence of paying out of pocket expense to different services. We times with the mean cost per cases. And this information, detailed information, or in my paper is really hard to elaborate them here. So the total national cost for people spend time seeking services because of others drinking is $573 million each year, and the out-of-pocket expense experienced by the people using services because of others drinking, the total cost is $130 million each year. We also calculated the ALD services treatment and direct line services that due to for the people that due to others drinking. We found $2.10 million was allocated by the Australian government to the direct line, which is attributable to others, to the people to others drinking, and $1.73 million was allocated to the alcohol and drug treatment services to deal with or treated people who had been affected by others drinking. And this is a summary of the cause of alcohol harm to others. If we look this chart, this table here, we can see that the large quantity of the cost from others drinking is a loss of quality of life for the people being harmed by others drinking. The second, then followed by the property and personal belongings damage and other out-of-pocket expense, and then the informal caregiving and child protection. for the public spending, for the government spending on the services and hospital and treatment and spending on the counseling services, it was not that. It was smaller than the spending on the household themselves. And this pie chart shows the proportion of different spendings due to others drinking in Australia in 2016 to 17. As we can see here, the 40% of the total cost belongs to the quality of life loss due to someone's drinking around these people. The second part is the property belonging, with property belongings, damage and other expense, such as the out-of-pocket expense, which take 26% of the total cost of alcohol harm to others. The informal caregiving, child protection, and these four big parts aid together nearly about it's over 80% of the total cost. So it's huge amounts here. And to conclude, our study is the first to comprehensively measure the cost of alcohol harm to others in the field. Our study reviews that over 2/3 of Australian adults have been adversely affected by someone else's drinking, costing the country the estimated $20 billion a year in healthcare and social services, informal caregiving, lost quality of life, and diminishing productivity. The cost for the agencies that address the needs of those affected by this drinking, for example, like hospitals, the criminal justice system, police, and alcohol and the drug treatment and counseling services are quite large. The cost to private individual or household are greater than the cost to the government or society due to others drinking that we found. The cost to the private individual or household take about nearly 90% of the total cost of alcohol harm to others. The majority of the cost of alcohol harm to others seen from the loss of quality of life, damage to property, personal belongings, other related expense, and time spent on informal caregiving. Our study findings doubled the total societal cost of alcohol use, which is the cost of alcohol use to the drinker plus the cost of alcohol use to the people around the drinkers in Australia. And this means that it's likely that this cost could be doubled in many other countries. Of course, there are some study limitations in our study. Many costs of adverse effects of drinking on children were not measured. The cost of fetal alcohol spectrum disorder, miscarriage, stillbirth, and unweighted birth data we couldn't connect from the data custodian. The cost of research and public prevention initiatives didn't include. The cost of police and crime services hasn't been included because of lack of data. The cost of suffering from separation or divorce attributable to others drinking was not included because of lacking data. For the cost to private individuals or household attributable to others drinking, we had to relate to the alcohol harm to others survey. And the existing Australian alcohol harm study was conducted in 2008. It's a bit out of date, but luckily we have conducted a new survey last year, and we're aiming to release the result by the end of the year or maybe next year, and then we will be updated the cost of alcohol harm to others in 1 or 2 years later. There are some policy implications of our study. Preventing harms from others drinking is as cogent and urgent a public health goal as preventing harm to people from their own drinking. Active intervention in alcohol markets will reduce these externalities. Alcohol control policies, such as raising tax price or introduce a minimum unit price, like what the Northern Territory government has done, the $1.30 minimum unit price in Northern Territory, and then controlling liquid outlet density and brief intervention on heavy drinking all could not only reduce harms and cost to the drinkers themselves, but may also reduce cost and the burden of alcohol use caused to the people around the drinker. Yeah, thank you.
Jason, thank you so much. That was so impressive, and some jaw-dropping figures there, and some really alarming costs, and quite clearly, a need for urgent action. And I'm sure lots of people would be asking the same. And please encourage people to come forward with questions. Was there anything that sort of surprised you based on some of the earlier work that you outlined in the introduction from these new quantifications?
Yeah, from my point of view, sorry, my cough. I found that the cost to the individual and the household is huge, and which take 90% of the total cost of alcohol harm to others. Because before I conducted an estimate, I thought the cost to the government, like to the healthcare and social services system, would be just large, take a larger proportion, but that's not the case. Yeah, and a huge amount of cost attributable to alcohol use, other people that alcohol use was due to and the people who has been lower their quality of life.
Yeah. And a question I had around the methodology is how you sort of disentangle, how you separate out the costs. If somebody's drinking themselves and they've said yes to, I've been affected by someone else's drinking, how do you separate out the costs when there's a reduced quality of life, or, counselling has been sought or something? Is that not possible?
We didn't measure that. Do you mean the drinker themselves, but also affected by others drinking?
The respondent. So
the respondents. We compare in our measurement. We didn't compare whether the treatment has affected their quality of life, but we do compare the people who being harmed and who wasn't harmed by this drinking, and to compare the quality of life scores. For those being harmed a lot and a little, the quality of life scores were significantly lower. And then we based on the gaps between the two different subgroups, two different groups, to calculate the cost of lowering their quality of life.
Right. But it's not possible that the figures could be inflated, because the people who said yes, they'd been harmed by another's drinking, may have also struggled with their own drinking, or experienced some reduced quality of life or increased health service use because of their own drinking as well.
That's a really good question. Yeah. There's some limitation, possibly because in our survey data we didn't design that way. Maybe in the future, I think that's good point. We can differentiate for those people who already suffered by their own drinking, but also receive harms from others drinking, and how their quality of life has been affected. They might be affected even worse.
Yeah, just another covariate.
Yeah.
Yeah. So a question we have is, do you have a sense of how much each of the interventions that you've suggested might save? So I know you mentioned at the end reducing minimum pricing, unit pricing, and increased tax and restrictions on outlet density. This
is a very complex question. One of my projects is modeling the alcohol pricing policy change affected people's drinking and related burdens and diseases. I think what I found in my module is I just talk about alcohol pricing policy. I don't know other like brief intervention or liquid outlet density controls. But in the pricing policy, we found the minimum unit price has quite significant impacts. The 10% increase. If other states follow the same procedure as the Northern Territory government they've done to introduce $1.30 minimum unit price, was significantly reduced the very heavy drinker, because the drinker for the minimum unit price has a very moderate impact on the moderate drinker and light drinker, but it has a significant big impact on the very heavy drinker, because very heavy drinker, they relies on the cheap alcohol. A lot of them, we found like maybe 40% or 50% of alcohol consumption they consume are cheap alcohol, like cask wine or cheap bottled wine or fortified wine. The minimum unit price was specifically targets on those very heavy drinker who consume cheap alcohol. It can reduce their the very heavy drinkers' alcohol consumption by 18%. If the 18% alcohol consumption reduce, that's a lot, because those people drink more than 60 standard drinks a week. So it might reduce like 15 standard drinks a week for them, or more than 10 standard drinks. That's significant amounts, and will help to reduce the harms they cause to the people around them.
Yeah. I mean, I was amazed even at the figure you presented there. I think $1, the return on investment for every dollar spent, returning $9 in investment.
Yes,
it was with the WHO figure. So I mean, it sounds like obviously, as always, we need a multi-pronged approach. At the sort of public health approaches, but also intervention approaches for individuals and for the others, for the others who are affected by someone's drinking. Have you got a sense from the harm to others survey whether there are figures or statistics that differentiate affected family members to others that may be affected, such as colleagues, victims of crime? That's one of the questions that's come in.
Yeah, it is different. In our 2008 survey, we do find that the people who received higher proportion of respondents received harms from their family and their household, or we can say from the people they know, especially for people living with them, like family or household. They received a less proportion of respondents report they being harmed by friends or co-workers. And the people who they known harmed them even more than the strangers. Most of the surveillance harm, like verbal abuse or physical abuse.
Yeah. Thank you. And we have a question from Fiona at Shark. So this goes back to your discussion on minimum unit pricing, and if there was an increase in the price of alcohol, the cost of alcohol, would there be an anticipated increase in crime rates in the literature or the modelling that you've been involved in or have read?
That's a really interesting question. We recently finished our modelling on minimum unit price and tax increase affect the social harms, including crime and alcohol-related sickness absence. And the paper's under review now. So what we find is the increase in price or tax would significantly reduce crime rate. We wouldn't say it's a large amount, but somewhere between 3% to 6%, I think. Yeah, it depends on the subpopulation groups, because we split by age, gender, and the different drinking levels.
Yeah. That's one thing that I thought of when you were presenting those costs and the different types of costs. I was wondering if there were any groups, any sort of demographic that stood out as increasing that sort of burden You know, is it younger adults? I mean, we've read so much about declining alcohol consumption rates in younger adults. We've also heard a lot recently around, I think it's AIHW data around older adults or middle sort of 55 and up being more likely to be regular drinkers, and other work at CAPER has shown, you know, it's often women, in middle-aged women who are of increased consumption. So have you got a sense of when this burden is greatest, or for, you know, which demographic?
Well, if we, based on the calculation, because the most heavy drinking behavior happens among young people, we do observe the middle-aged women and some old people, their drinking habits hasn't changed over time. But most of these harms were from the younger age groups.
Right.
Yeah.
Okay, there's a very quick question again in relation to your modelling on minimum unit pricing. When will that be available?
Hopefully we get a review from the reviewer, and then we can talk about that paper. Yeah, okay. Maybe by the end of this year or early next year.
Okay, but otherwise people can get in touch with you and
sure. I'm happy to answer any questions.
Yeah, get some early access. Yeah. We've got a question from Michael, who is saying, you know, great, like many people here, great, really enlightening presentation. How would you account for the potential benefits of alcohol consumption in terms of the enhanced social connection, fun, pleasure that would arguably contribute to well-being for the drinker and others in your calculations?
Wow, that's a really good question. There are some arguments about social welfare or maybe social benefit from drinking, because the arguments suggest that drinking, moderate drinking, or you know, people social drinking, they increase their friendship or you know, social gathering. But as we can, there's some recent evidence from Lancet showing even the light drinker, they would have some risk for some long-term like cancer or liver cirrhosis diseases. For harm to others, really hard to say. What our study aim is the harms from others drinking. We didn't measure whether there's any benefit from others drinking. So it's really hard question for me to answer. Yeah.
So I mean, some of that cost or burden could have been offset by benefits from one's own drinking, or you know, someone else's, potentially, I guess. And a limitation of the data.
Yeah, a limitation.
Yeah. Thank you, Jason. Well,
thank you, Vic.
Thank you for answering all our questions, and and thanks again for coming today and presenting such important work. I'm sure people will be following up with you on email, and thank you to everybody who attended, and we'll see you next month.